welcome to the Deep Dive, your shortcut to being genuinely well-informed. Today, we're plunging into a topic that really affects every single one of us, yet its full weight. It often goes completely unnoticed. We're talking about the immense, profound pressures faced by healthcare professionals, especially our nurses. And it's more than just demanding schedules or the physical strain of long shifts. Those are definitely part of it.
Absolutely.
We're delving into the deep emotional and psychological toll that these essential workers carry. It's a burden most of us, as patients or just members of the public, we barely begin to grasp.
It really is. It's like an unseen battle playing out every single day in our hospitals, our clinics, our care facilities. And understanding the well-being of these vital professionals is so critical because it directly, undeniably impacts the quality of care that, well, you and I and our loved ones receive.
That's exactly right. So for this deep dive, our mission is kind of to journey into that incredibly complex world of healthcare worker well-being.
Right.
We want to truly unpack the significant challenges they grapple with, explore the often hidden but incredible personal strengths they draw upon just to keep going.
Yeah, their resilience.
Exactly. And crucially, identify the organizational supports that either lift them up and allow them to thrive or, sometimes devastatingly, can break them down.
And to guide us, we've navigated, well, a carefully curated stack of recent research, some really in-depth studies and comprehensive reviews. We've tried to extract the most important, sometimes surprising insights to give you a truly comprehensive and well-informed view of what genuinely helps and what severely hinders these vital professionals.
Okay.
Get ready for some, I think, eye-opening facts and some powerful takeaways that we believe will absolutely shift your perspective on what it means to be a caregiver today.
All right. Let's kick things off by really understanding the language of stress in healthcare. These aren't just, academic terms. They're measurable, impactful realities for these professionals. We're going to start with a concept called emotional labor, often shortened to EL. Now, you might have heard this term, but it was originally defined by the sociologist Arlie Hochschild. She defined it as the requirement for employees to express certain emotions at work, regardless of, well, how they genuinely feel internally.
Right. And what's truly fascinating and often incredibly taxing here is that this requirement almost invariably leads to what's called emotional dissonance.
Dissonance, okay.
Yeah. Think about a nurse, for example. They might be internally feeling utterly drained after a difficult shift, maybe frustrated by some critical equipment malfunction, or even grieving a patient loss.
Sure.
Yet they are expected, as part of their job, right, to consistently display friendly, empathetic, and reassuring emotions to every patient, every family member, every colleague.
So always on.
Exactly. This profound mismatch between their true internal state, their authentic feelings, and the external emotions they are required to perform creates this constant, uncomfortable psychological state. It's an ongoing internal conflict that takes a significant cumulative toll. It just chips away at their well-being.
And when that kind of sustained internal conflict and exposure to demands becomes prolonged, we inevitably see the development of burnout, or BO.
Burnout.
This is far more than just feeling tired after a particularly grueling shift, isn't it?
Oh, absolutely. Clinical studies consistently define burnout as a measurable syndrome. It develops from prolonged exposure to unrelenting physical or psychological stressors. And it's characterized by a profound depletion of energy, a deep, pervasive exhaustion that goes far beyond simple physical fatigue.
It's like your internal battery is not just low, it's completely dead and just can't recharge.
That's a great way to put it. And when researchers actually measure burnout, they typically look at two key dimensions. First, there's emotional exhaustion, which is that feeling of being utterly drained, depleted, emotionally empty, like you have nothing left to give.
Right, just tapped out.
Completely.
Yeah.
The second major component is depersonalization.
Depersonalization. What does that look like?
Well, it manifests as a cynical, detached, or impersonal attitude towards one's work, their patients, or even their colleagues. It's almost like a protective mechanism,
Yeah.
A way to create distance from the overwhelming emotional demands.
Like putting up a wall.
Exactly. And if we connect this to the bigger picture, it's absolutely critical for us all to understand. High levels of nurse burnout are consistently and directly associated with a measurable lower quality of care for patients.
Wow.
This holds true regardless of the specific practice environment.
So it's not just about the nurse. It directly impacts patient safety.
Directly. And beyond patient care, burnout seriously contributes to physical and psychological health complications for the nurses themselves. Think of chronic stress, anxiety, depression.
Hmm.
And it significantly reduces their work motivation, engagement, and ultimately their longevity in the profession. People just leave.
Building on that concept of burnout, we frequently encounter compassion fatigue, or CF. What's the distinction there?
Well, compassion fatigue is often described as the direct, heavy cost of caring. It results from constantly witnessing and absorbing the problems, suffering, and trauma of others, especially when you're working day in and day out with individuals who have experienced profound trauma or are in immense distress.
This is like empathy overload.
Kind of, yeah. It's the empathy that slowly, insidiously wears you down.
I see.
Compassion fatigue is indeed intimately linked to burnout. It often acts as a key pathway to burnout in caring professions. It powerfully highlights the sheer, immense emotional and empathic demands inherent in healthcare. You're not just performing clinical tasks, you are engaging with human suffering, vulnerability, often tragic circumstances.
On a deeply personal level.
Exactly, on a profoundly personal level, day in and day out. It's an emotional immersion that few other professions demand to such an extent.
But thankfully, it's not all doom and gloom on the emotional front for healthcare professionals, is it? There's also a counterbalance.
That's right. There's also a powerful counterbalance. Compassion satisfaction, or CS.
Okay, compassion satisfaction.
This is the positive, enriching emotion that springs from the deep satisfaction felt when providing care to patients and genuinely making a difference in their lives. It's truly the other hopeful side of that emotional coin.
The reward part of caring.
Precisely. Higher compassion satisfaction directly translates to greater joy, a stronger sense of purpose, and ultimately more effectiveness in one's role as a caregiver. It's the intrinsic reward that can sustain many individuals in the profession, offering a powerful counterbalance to the emotional demands and the potential for fatigue.
That makes sense.
What's fascinating, and something that raises an important question for healthcare leadership, is that studies have found nurses with doctorates, for example, tend to report higher levels of compassion satisfaction.
Oh, interesting. Why might that be?
Well, we don't know for sure, but it makes us wonder. How can we intentionally foster environments and pathways that maximize this sense of deep satisfaction for all healthcare workers, regardless of their specific role or education level?
Right. It shouldn't just be for certain groups.
Exactly. It's not about just hoping it happens. It's about actively cultivating it.
Okay, now that we've established those foundational emotional concepts, the labor, the burnout, the fatigue, and the satisfaction, let's zoom in on the specific, tangible, key stressors in the healthcare environment that really push these professionals to their limits.
Right.
First and foremost, we have workload and intensity.
Yeah, this is a huge one. Healthcare settings, particularly high acuity environments like emergency departments or ICUs, are notorious for what researchers call quantitative workload.
Quantitative workload,
Wait,
meaning,
what that really means is there's simply more work, more patients, more tasks than can be effectively handled by the available staff.
okay,
This isn't just about being busy, it's about being perpetually, unsustainably overwhelmed.
just too much to do, not enough time or people.
Exactly. You see this phenomenon manifest most directly and dangerously in patient-to-nurse ratios. Studies consistently and unequivocally show that high patient-nurse ratios are a massive predictor of increased burnout and profound job dissatisfaction among nurses.
Okay, so the number of patients per nurse really matters.
Critically. But this isn't just an abstract staffing issue for hospital administrators. It has direct, dire consequences for patient safety. High ratios directly translate to higher rates of patient mortality and what are known as failure to rescue incidents.
Failure to rescue.
Yeah, where patients may not receive the timely critical interventions they need because the nurse is simply stretched too thin. They miss subtle signs, perhaps.
So there's a direct link. Understaffing equals increased risk for patients.
Undeniably.
And, of course, the COVID-19 pandemic just blew this all up, didn't it? It dramatically, catastrophically intensified this already immense pressure.
Absolutely. It added entirely new, unforeseen demands, particularly on mid-level nurse managers. They reported staggering anxiety levels. Around 75% experienced high anxiety during just the first wave alone. 75%.
That's incredible.
We saw direct correlations between these increases in workload and elevated patient-related burnout, alongside significant declines in overall work engagement for frontline staff. It was just a perfect storm of stress.
And it's important to understand that this isn't solely a pandemic thing, right? This pressure exists outside of crises, too.
That's a crucial point. Broader, ongoing studies consistently show that when general work pressure is higher than usual, even outside of a global crisis, it profoundly exacerbates emotional exhaustion. And it negatively impacts vigor and dedication, which are the core components of what we define as work engagement.
So even small, persistent increases in pressure add up.
They do. The kind that might just feel like another busy day can have a cumulative, compounding negative effect on a nurse's long-term well-being and their ability to stay engaged in their critical work.
Okay, here's where it gets particularly jarring, I think. Workplace violence, or WPV.
Unfortunately, yes.
This is a pervasive, common threat within healthcare settings, whether it's violence from agitated patients, aggressive visitors, or even, disturbingly, from peers.
Yeah, that happens too.
Experiences of such violence are consistently and significantly associated with higher burnout levels among healthcare workers. It's this constant undercurrent of fear and disrespect.
It really is. And this raises an urgent and deeply troubling question for our society. Why is this still so pervasive and seemingly almost accepted in healthcare environments?
Good question.
It's not just physical assaults, which are horrific enough. Even peer-to-peer workplace violence, bullying, incivility, that sort of thing, which often flies under the radar or gets dismissed as drama,
Right.
can lead to profound psychological distress and significantly decreased work engagement. It systematically erodes trust, psychological safety, and cohesion within the team, making an already high-stress environment feel actively hostile.
Okay, so we have workload, violence. What about technology? You'd think that might help ease the burden.
You would think so. But surprisingly, the implementation of electronic medical record systems, or EMRs, can actually be a significant stressor itself.
Really? How so?
Counterintuitively, the anticipation of implementing new EMR systems, even before they go live, acts as a major source of anxiety and stress for nursing staff.
It's just the thought of it.
Yeah, it's the unknown, the fear of the learning curves, the worry about how it will impact workflow.
And are those fears justified?
Often, yes. They frequently stem from perceived training gaps. Nurses consistently express feeling overwhelmed by inadequate training for these complex systems. They cite examples like one-day marathon sessions crammed with far too much information delivered in a one-size-fits-all manner.
Yeah, this doesn't sound effective.
Not really. They clearly articulate a need for varied learning styles, more hands-on practice, maybe staggered training, opportunities for peer support, and crucially, more dedicated time to truly master these new, often cumbersome systems.
So if you're struggling with the tool meant to help,
Exactly. If you're struggling to efficiently use the very tool meant to streamline your work, it instantly transforms into yet another demand, adding to the cognitive load and frustration rather than alleviating it.
makes sense. Okay, moving on. The COVID-19 pandemic really added its own unique and devastating toll, didn't it? Beyond the physical risk and workload.
Oh, absolutely. Beyond the sheer physical risk and overwhelming workload, frontline caregivers faced incredibly difficult moral dilemmas during the pandemic.
Moral dilemmas. Like what?
Well, they often had to make impossible choices about resource allocation, like who got the last ventilator or who received certain life-saving care, or how to comfort dying patients when their families couldn't be there.
Oh, gosh. That's heavy.
Incredibly heavy. This frequently led to profound feelings of powerlessness, moral injury, and injustice, which directly and powerfully contributed to their burnout.
Moral injury. That's a powerful term.
It is, and what's particularly poignant here is the direct link between traumatic exposure and long-term well-being. Direct, repeated contact with patients who had experienced traumatic events during the pandemic, whether it was the virus itself, the isolation, the struggle to breathe, was strongly associated with lower psychological well-being and less positive relationships with others for healthcare personnel.
So it affected their personal lives, too.
Deeply. This wasn't just about the physical risk of infection. It was a deep, pervasive psychological burden that lingered long after their shifts ended, impacting their entire lives.
And the consequences are stark, something that should alarm all of us.
Yeah.
You mentioned people leaving the profession earlier.
Yes. Severe work-related anxiety and burnout during the pandemic were strongly correlated with a significantly higher intention to quit, particularly among doctors and nurses who are in those critical decision-making roles with increased workload.
We risk losing huge swaths of our most experienced, dedicated healthcare workforce because the system simply broke them.
It really underscores the profound vulnerability of those in leadership and direct patient care roles during crises. Their amplified workload, The sheer emotional demands, the moral weight of their decisions pushed many to the brink, leading them to seriously consider leaving the profession entirely.
It's a wake-up call then. We need to better protect and support those we rely on most in times of crisis.
Not just for their sake, but for the resilience of our entire healthcare infrastructure.
Right. Okay. Next up, a critical, often invisible stressor, the lack of autonomy and value conflicts.
Ah, yes. This is crucial.
Nurses, despite their extensive training and clinical expertise, frequently find themselves in situations where they're asked to perform tasks or follow protocols that directly conflict with their professional values, their clinical judgment, or what they instinctively know is best for a patient.
It's an ethical and professional bind, isn't it? This internal conflict is particularly pronounced in hierarchical healthcare settings, which, let's face it, many still are. Take enrolled nurses, or ENs, in long-term care facilities, for example. Studies show they reported a significant lack of autonomy due to rigid reporting lines.
Rigid reporting lines.
Yeah, and a pervasive feeling of being excluded from crucial discussions with medical professionals about patient care. Despite having direct, intimate, often 247 knowledge of the residents' needs, nuances, preferences.
You're the ones right there.
Exactly. They felt their voices weren't heard or that they couldn't act on their well-informed judgment. This fundamentally undermines their sense of professional identity, their competence, and their crucial contribution to care.
It basically tells them your expertise doesn't matter here.
Precisely. Which is incredibly demoralizing.
So when we stitch all these stressors together, the workload, the violence, the tech issues, COVID, the lack of autonomy, what does this all mean for the broader consequences, impact on nurses and organizations?
Well, a major direct outcome is lower work engagement, often abbreviated as WE.
Lower engagement.
Yes. Emotional labor, particularly when it's high and uncompensated emotionally, is consistently linked to significantly lower work engagement. As burnout intensifies and takes hold, work engagement inevitably diminishes. It creates a downward spiral.
It's a vicious cycle. Feeling drained makes you less invested, which makes you more drained.
You got it. And the spiral unfortunately leads to a major system-wide concern: high intention to quit and pervasive turnover.
People just leaving.
Yeah. Studies consistently show alarming attrition rates among healthcare workers. Even in studies specifically focused on well-being interventions, people are trying things, but they're still leaving. Burnout and profound job dissatisfaction are massive drivers, actively causing nurses to leave their roles, and sadly, often the profession entirely.
How bad is it?
In one eye-opening study, about 23% of nurses explicitly indicated an intention to leave their current role. That's nearly 1 in 4.
Wow. 1 in 4.
And fatigue, particularly chronic, unaddressed fatigue, is highlighted as a significant factor that can prematurely cut short a nurse's career. This leads to a catastrophic loss of valuable experience and expertise from the workforce.
And the ripple effect of this is clear. And again, should resonate with everyone listening. A nurse's well-being directly, powerfully impacts patient outcomes.
Absolutely. The connection to patient safety and the overall quality of care is simply undeniable. It's not an abstract concept. Hospitals with consistently high patient-to-nurse ratios, which inevitably lead to higher nurse burnout, experience measurably higher patient mortality rates.
Higher death rates. It's that direct.
It is. This isn't just about nurse satisfaction. It's about life and death.
This is truly where the issue hits home for every individual, isn't it?
It really is. The well-being of a healthcare professional isn't just an internal issue for them or a human resources problem for their organization. It is, at its core, a public health issue. A stressed, overworked, and burnt-out nursing staff can, however, inadvertently compromise patient care, leading to errors, delays, and ultimately serious consequences for those under their care. It's a systemic risk that demands systemic solutions.
Okay, given these significant, multifaceted challenges, it might feel a bit overwhelming. But let's now pivot to the inner armor, personal resources for resilience. What are healthcare professionals doing, and perhaps more importantly, what can they do to protect themselves and sustain their capacity to care in such demanding environments?
Right. Let's look at the protective factors.
We'll start with mind-body practices, specifically comparing heartfulness meditation versus gratitude practices. Let's begin with heartfulness. What is that exactly?
Heartfulness meditation is a practice focused on gentle, guided meditation aimed at connecting with the inner self, often focusing on the heart area. Research has directly linked this practice to significant improvements in burnout levels and increased vigor at work.
Vigor, okay. More energy.
Yeah, more energy, more vitality. And it showed a positive trend towards greater compassion satisfaction as well. Beyond professional benefits, it was also shown to decrease loneliness and measurably improve sleep quality among healthcare workers.
Sleep! That's huge for shift workers.
Incredibly crucial given the demands of their shifts. You might ask, why might it be so effective? Studies point to its accessibility. The virtual nature of many heartfulness programs makes them easily accessible to busy healthcare professionals.
So they can do it on their own time.
Pretty much. And critically, participants highlighted the immense benefits of instructor-led sessions for accountability. That external structure makes it easier to stick with a practice when your life is chaotic.
Right, someone to keep you on track.
Exactly. Specific reported benefits included not just stress management, but increased compassion and a tangible improvement in work-life balance, helping them compartmentalize and leave work at work, so to speak.
That's incredibly powerful, especially the tangible benefits like improved sleep and vigor. Now, how do gratitude practices compare? These are often simpler, maybe daily reflections on what one is thankful for.
Yeah, that's generally the idea. While perhaps not as directly impactful on work-related metrics like burnout or vigor compared to heartfulness in these studies, gratitude practices were reported to enhance family life.
Oh, interesting. How?
By encouraging individuals to share these practices with family members and consciously manage time for self and family, participants also found them useful for recalibrating for future challenges, fostering a positive outlook even in difficult circumstances.
So more about perspective shifting.
Seems like it, yeah. What's truly interesting is to highlight the distinctions between these two approaches. Notably, the gratitude group, while reporting broader life benefits, did not report the improved sleep or reduced fatigue seen in the heartfulness group.
Okay, so different tools for different jobs, maybe.
It subtly suggests that, yeah, certain mind-body practices might be better suited for specific outcomes. For example, heartfulness appears to directly address the physiological and emotional toll more, while gratitude helps with a broader psychological recalibration.
But there was a catch.
There's a common challenge.
Okay.
Both practices, despite their documented benefits, faced high attrition rates. People dropped out.
Why?
A perceived lack of time was the most common reason, which is a pattern seen across many virtual interventions for healthcare professionals.
They just couldn't fit it in.
Right. This implies that even beneficial self-care practices struggle to fit into the relentless, demanding reality of healthcare professionals' lives. It underscores the need for systemic support rather than solely relying on individual coping.
That makes sense. You can't meditate your way out of unsafe staffing ratios.
Precisely.
Okay, so beyond structured practices, what are some key psychological strengths and coping mechanisms that act as this inner armor for individuals?
Right, let's look at internal resources. One truly powerful personal resource is self-efficacy.
Self-efficacy, define that for us.
It's fundamentally an individual's belief in their own capacity to execute behaviors necessary to produce specific performance attainments.
Okay, so in simpler terms.
It's a nurse's deep-seated belief in their own ability to effectively handle the challenges of their job, to competently perform their duties, and to achieve desired outcomes for their patients, believing, I can do this.
Got it. And how does that help?
Well, that belief system is a strong predictor. Self-efficacy positively predicts a nurse's participation and engagement in the workplace. When you believe you can do something, you're more likely to try, to persevere, and to engage fully.
But is it enough on its own?
That's the key question. If we connect this to the bigger picture, it's not an infinite resource. The positive effect of self-efficacy on engagement can significantly diminish when nurses perceive consistently high stress levels.
So stress can override it.
It can weaken its protective effect. This suggests that while self-efficacy is vital, acting as a crucial internal buffer, it cannot fully compensate for an overwhelmingly demanding or toxic environment. It acts as a shield, yes, but not an impenetrable force field against systemic issues.
Okay. Another key strength mentioned in the research is sense of coherence, or SOC. What's that about?
Think of SOC as a deep, confident understanding of the world around you and your place in it. Nurses with a consistently high sense of coherence, of feeling that one's internal and external environments are predictable, that life's challenges make sense, and that there's a high probability that things will work out as well as can reasonably be expected, consistently report better self-reported health.
So it's about feeling like the world is generally manageable and understandable.
Exactly. It's about having a fundamental trust in the order and manageability of things, even amidst chaos.
How does that break down?
SOC is truly comprised of three interconnected pillars. First, comprehensibility, which is about understanding life's challenges, seeing them as predictable or at least explicable.
Yeah, okay, making sense of things.
Second, manageability, which is the feeling of having the resources or capabilities to cope with those challenges, believing you can handle it.
Right.
And third, meaningfulness, which is seeing a purpose or value in the challenges you face, making them worth the effort.
Comprehensibility, manageability, meaningfulness. Got it.
All three dimensions were directly linked to more effective stress coping. What's particularly insightful is that nurses who reported no work-related family conflicts also exhibited a higher SOC.
Ah, so home life impacts work resilience too.
Profoundly, it suggests the huge impact of a supportive home environment on professional well-being. It's not just about what happens at work, but how your broader life context supports your ability to make sense of and manage stress.
This also raises an important question about how we approach our work goals, which affects our well-being. There's a concept called regulatory focus,
Yes, regulatory focus theory.
specifically comparing a prevention focus versus a promotion focus. Can you unpack that?
Sure. This refers to an individual's underlying orientation towards achieving goals. A prevention focus emphasizes security, safety, and meticulously avoiding negative outcomes.
So it's about not messing up.
Essentially, yeah, or not losing what you have. It's driven by safety needs.
And the alternative.
In stark contrast, a promotion focus emphasizes growth, advancement, and actively achieving positive outcomes.
And so that's more about gaining something new.
Or making things better. It's driven by growth and accomplishment needs.
And how does this impact nurses?
The research on this is quite compelling. Studies show that a prevention focus is associated with an accelerated accumulation of emotional exhaustion.
Burns you out faster.
Seems like it. If you're constantly on guard, constantly worried about what could go wrong, it takes a toll. This focus can even attenuate or slow down the acceleration of work engagement.
How so?
You're so busy avoiding problems, you're not fully engaging with the positive aspects of your work, perhaps.
Okay, but what about the promotion focus?
Here's the powerful flip side. A promotion focus is linked to the accelerated accumulation of work engagement.
So focusing on growth makes you more engaged.
It seems so. When you're focused on growth and positive achievements, you become more engaged, more energized by your work. And importantly, it doesn't seem to significantly influence the acceleration of emotional exhaustion in the same way.
Interesting. So this isn't just abstract psychology.
Not at all. It suggests that how nurses frame their work, their daily tasks, their overarching goals can significantly influence their long-term well-being and engagement.
Which makes you think about how organizations could influence this.
Yeah. Absolutely. It prompts us to consider how organizations might actively encourage a promotion focus through goal setting, recognition, development opportunities, while mitigating the conditions that force nurses into a constant state of prevention focus, which is essentially working from a place of fear or avoidance.
Right. Okay, and during the height of the COVID-19 pandemic, we saw the stark realities of coping strategies of nurse managers. What did the research show there?
Under unimaginable levels of stress, these managers employed distinctly different coping styles. What's intriguing is that those with longer nursing tenure, those who had been in the profession for a significant time, tended to employ more adaptive strategies.
Adaptive, meaning healthy ways of coping.
Yeah, healthy, constructive ways to deal with stress, like problem solving, seeking support from others, positive reframing, planning.
Okay, but what about the flip side?
Conversely, and this is a critical warning sign for any organization, high levels of anxiety were strongly linked to maladaptive strategies.
Maladaptive, so unhealthy coping?
Exactly. These are problematic and often self-destructive behaviors such as denial, substance abuse, venting excessively without resolution, self-blame, or behavioral disengagement, which means withdrawing from responsibilities or interactions. Just checking out.
Those sound really damaging.
They are. These strategies not only fail to address the underlying stress, but actively negatively impact mental well-being and can lead to social isolation, trapping individuals in a downward spiral.
So what's the takeaway for organizations?
This data highlights an absolutely crucial need: providing targeted, specific training programs for nurse managers. This training should not only aim to reduce their baseline anxiety, but, even more critically, specifically address and help shift maladaptive coping mechanisms. It's about equipping them with healthier, more sustainable tools to manage stress.
Building resilience and leadership.
Exactly. This kind of investment is about preparing them not just for current crises, but for all future disasters and demanding periods, building a more resilient, effective, and well-supported leadership foundation within healthcare.
So we've looked at the incredible personal resources individuals can draw upon. But as powerful as those inner tools are, they are not a complete shield, are they?
Definitely not.
Because no matter how strong an individual is, the environment in which they work profoundly shapes their experience. Let's turn our attention now to the organizational shield, workplace support and environment.
Right. The system matters hugely.
We'll start with high-involvement work practices, or HIWPs, and the concept of empowerment. What are HIWPs?
These are essentially organizational strategies explicitly designed to enhance employee discretion and participation, creating a less constrained, more empowering work environment.
Giving employees more say.
Absolutely. Think of HIWPs as giving employees more of a voice and more control over their work.
What do they actually involve?
Components include robust bottom-up and top-down information sharing, meaning communication flows freely in all directions, not just orders from the top. It also involves consistent non-monetary recognition for effort, genuine acknowledgement and appreciation, not just paychecks.
Feeling valued.
Yes, and critically, it includes continuous training and development opportunities, showing that the organization is invested in their growth. These practices collectively foster a strong sense of being valued, trusted, and genuinely involved in the mission of the organization.
And how does this link to empowerment?
HIWPs are closely linked to psychological empowerment, which is truly central to a professional nurse's identity and sense of purpose. Psychological empowerment helps nurses feel truly capable of contributing to high-quality care, feeling like their decisions matter, and that they have agency in their role.
Which helps with burnout.
Directly. This, in turn, directly aids in managing and mitigating burnout. In fact, studies show that high levels of psychological empowerment in settings like long-term care facilities are directly associated with significantly higher job satisfaction among nurses.
It's the difference between feeling like a cog in a machine and feeling like a vital, contributing professional.
Perfectly put. What's truly fascinating and impactful here is that HIWPs can directly and indirectly alleviate burnout. They do this by effectively reducing job demands, such as role overload and conflict, because empowered nurses can often find more efficient ways to do their work or advocate for better processes.
So they have more control.
Exactly. Psychological empowerment itself acts as a crucial mediating variable in this link between HIWPs and reduced burnout. It's about more than just giving nurses tasks. It's about giving them the authority and belief in themselves to truly shape their work and their environment. That's a powerful antidote to feeling overwhelmed and disempowered.
Okay, next, we absolutely have to talk about the critical role of leadership. This comes up again and again.
It's paramount. We've seen in countless studies that leaders who inspire and motivate their teams, what we call transformational leaders, have the profound potential to significantly improve work engagement among nurses.
They don't just manage. They uplift and guide.
Right. And it goes beyond just inspiration. Leaders who consistently embody ethical principles and demonstrate fair conduct, what researchers call ethical leadership, can act as a crucial stress buffer against the relentless demands of emotional labor.
How does ethical leadership buffer stress?
They create a culture of trust and integrity. Nurses feel safe, supported, and confident that they are being treated fairly, which helps to mitigate that internal conflict nurses often face between their values and workplace realities. This kind of leadership sets a foundational tone that helps reduce stress and prevents burnout by fostering a psychologically safe environment.
But then there's the dark side, toxic leadership.
Oh, yes. On the opposite, terrifying end of the spectrum, toxic leadership is unequivocally identified as the single most threatening leadership style in healthcare. It has a direct, devastating negative effect on nurses' mental well-being, and both direct and indirect negative impacts on their work engagement. It's not just ineffective, it's actively harmful.
What does toxic leadership actually look like in practice?
It can involve a range of behaviors. A leader who is consistently rude or disrespectful maybe allows their fluctuating moods to dictate the unit's climate.
Walking on eggshells.
Exactly. A leader who fails to value or acknowledge staff contributions, who belittles their staff's work, or even actively initiates conflict among team members to maintain control or deflect blame.
That sounds awful.
It is. And if we connect this to the bigger picture, mental well-being acts as a partial mediator in this relationship. Meaning toxic leadership directly damages a nurse's mental well-being, which in turn significantly reduces their engagement and motivation to do their best work. It's a systemic poison.
So the immediate manager's impact is paramount.
Absolutely critical. Nurse managers play this crucial role, and their overall support and positive perception by their staff are inversely associated with nurse burnout.
Meaning,
The more supported a nurse feels by their direct manager, the less likely they are to experience burnout. Simple as that.
so this raises an important question for hospital systems. How do we cultivate truly effective, supportive leaders?
That's the million-dollar question. Investing in training programs that specifically help leaders develop engaging leadership behaviors is highly beneficial. Such leadership influences well-being not just by managing tasks, but by positively shaping perceptions of the work environment and ensuring staff have essential job resources like autonomy, support, and clear feedback. It's about teaching leaders how to empower, not just direct, their teams.
Right. Okay. Beyond formal leadership, social support, teamwork, and safety are absolutely vital components of that organizational shield.
Huge factors. Increased support from colleagues, for instance, is directly associated with increased work engagement. That sense of we're in this together makes a huge difference.
Peer support.
Exactly. This kind of collegial support can either enhance or, in some cases, undermine the effects of psychological empowerment, depending on its quality and consistency. If your peers are supportive, empowerment feels better. If they're not, it can feel isolating.
And what about the team as a whole?
A strong sense of belonging and identification with one's immediate care unit or team is a powerful moderating factor against stress. It measurably strengthens the relationship between work engagement and reduced stress symptoms and burnout. It fosters genuine collaboration and predicts positive health outcomes for the nurses themselves.
So team cohesion is protective.
Very much so. When a team feels cohesive, when they truly feel like a unit, they are far better equipped to weather immense storms and support each other through the most challenging situations. This unity is a buffer.
And crucially, perceptions of safety are fundamental. Feeling safe at work.
Yes. And feeling personally safe at work isn't just about physical security, like protection from violence, although that is obviously vital. It is deeply, inextricably linked to lower burnout and higher engagement. A sense of certainty that adequate physical, emotional, and psychological protection is provided by the organization significantly enhances a nurse's coping capacity. It allows them to focus on patient care without constant worry for their own well-being.
Feeling secure allows you to do your job better.
Fundamentally, yes. Furthermore, relational coordination is a concept that often gets overlooked but is profoundly important.
Relational coordination.
What's that? This refers to how nurses relate and communicate with all stakeholders, not just their immediate team, but residents, families, the broader multi-professional care team, doctors, therapists, etc.
So communication across the board.
Exactly. Effective relational coordination is absolutely crucial for sensitively and effectively supporting residents' complex needs, especially in long-term care. Conversely, a pervasive lack of open communication, particularly with family members or other departments, can actively impede work engagement. It creates silos and barriers where there should be seamless collaboration, leading to frustration and inefficiency for the nurses striving to provide holistic care.
Makes sense.
No.
Okay, finally, let's talk about the often underestimated impact of the physical work environment itself.
Yes, the actual space they work in.
We're seeing a growing trend where many healthcare organizations are transitioning to shared workspaces, including patient reception rooms, team areas, office facilities, like open-plan offices in hospitals.
Right. However, surprisingly, research specifically on how these shared environments affect healthcare worker well-being is relatively rare given the scale of these changes.
So what do we know?
What's fascinating here is that the perceived functionality of these spaces significantly impacts work engagement. It's not just about aesthetics, how it looks.
Functionality, like how well it works.
Exactly. Factors like how well the overall facilities support efficient interaction and collaboration between different teams. And critically, the availability of quiet, private spaces for focused work or emotional decompression.
A place to think or just breathe.
Yes, those are strong predictors of work engagement. Even a perceived safety of patient reception rooms, in terms of feeling secure from potential threats, contributes positively to a nurse's sense of well-being and engagement.
But there are downsides too.
Oh, definitely. Specific challenges are reported frequently. Nurses express dissatisfaction with the basics. Natural lighting, window views, soundproofing, and adequate storage in these new shared environments.
Noise, lack of light, nowhere to put things.
Pretty much. This highlights how seemingly minor environmental elements, like being stuck in a windowless area with only harsh artificial lighting for an entire 12-hour shift can cumulatively contribute to a less satisfying, more draining work environment.
These aren't trivial complaints then.
Not at all. They compound the existing stressors and make it harder for nurses to feel comfortable, focused, and supported in their physical workplace.
Okay, so after this comprehensive journey through challenges, personal resources, and organizational factors, what does it all mean when we bring these together? How do they interact?
Right. The interplay is key. A highly insightful framework for understanding well-being at work is the Job Demands Resources, or JDR model.
The JDR model, okay.
This model provides a comprehensive and, I think, quite elegant way to understand the complex interplay that shapes well-being at work.
How does it work?
It proposes two main psychological processes that are constantly at play. First, there's the health impairment process.
Health impairment. Sounds negative.
It is. This is where excessive job demands, things like the heavy workloads we talked about, intense emotional demands, frustrating bureaucratic red tape, conflicting roles, or that emotional dissonance systematically lead to negative outcomes, with burnout being the most prominent and damaging. It's the pathway to depletion.
Okay, so demands lead to burnout. What's the other process?
Conversely, there's a motivational process. This suggests that sufficient job resources factors like autonomy in decision-making, clear roles and expectations, consistent performance feedback, ample opportunities to use and develop skills.
Things that help you do your job well.
Exactly. Potential for growth within the organization, task variety, strong alignment between personal and organizational values, robust social support from colleagues and leaders, a general sense of perceived organizational support, and a feeling that ethical work is feasible. These all actively lead to positive outcomes. Most importantly, high work engagement.
So resources lead to engagement. It's the pathway to thriving.
You got it. And this framework powerfully illustrates the protective role of resources. Job resources aren't just nice-to-haves. They can actively mitigate the negative, draining effects of job demands.
Like a buffer.
Essentially, yes, acting as a buffer.
Wow.
And simultaneously, they directly encourage higher work engagement. Studies consistently confirm a clear inverse relationship between these resources and burnout. More resources, less burnout.
Makes sense.
And a direct positive link between resources and engagement. More resources, more engagement. It's a powerful argument for investing in a resource-rich environment.
So organizations need to focus on boosting resources and reducing demands.
That's the core idea of the JDR model. Building on that, we also see the concept of job crafting emerging as a significant tool.
Job crafting.
Yeah.
What's that? Shaping your own job.
Pretty much. This is when employees proactively modify their job demands and resources to optimize their perceptions of their work environment. For a nurse, this might mean taking initiative to streamline a process they find frustrating, or seeking out opportunities to utilize a specific skill they enjoy, or intentionally building stronger relationships with certain colleagues to enhance support.
Taking control where they can.
Exactly. It's about taking agency to shape one's role to better fit their strengths and preferences. This can be a powerful tool for individual well-being and a proactive way to create a more sustainable work life, even within a demanding system.
Okay. Next, let's dive into a powerful psychological principle known as the bad is stronger than good principle in workplace events.
Ah, yes. This one is quite intuitive when you think about it.
What does it mean?
Research consistently suggests that in the workplace, bad is stronger than good. What this means is that negative workplace events tend to have a disproportionately greater impact on well-being and health outcomes compared to positive events, even if the magnitude of the events is similar.
So one really bad thing outweighs several good things.
That's the idea. Think about it. A truly awful shift, a confrontation with an aggressive family member, or a devastating patient outcome. These experiences tend to stick with us far longer and have a deeper emotional resonance than many positive interactions.
That rings true.
Specific negative events, referred to as constraints, things like equipment problems, a persistent lack of necessary information, or an overwhelming, unmanageable workload and conflicts, such as disagreements with values, physicians, peers, or difficult patients and families, are consistently shown to increase nurse burnout.
And these aren't just minor annoyances.
Right. Importantly, these aren't just routine daily hassles that you shrug off. They are often distinctive, unusual occurrences that really leave an emotional mark and chip away at a nurse's resilience.
Okay, so that's the bad. What about the good? What kind of positive events help?
On the flip side, we're looking at successes, like successfully saving a patient's life, overcoming a particularly complex clinical challenge, or effectively teaching complex self-care to a patient and seeing them grasp it. real wins,
Hmm.
and also supports simple but powerful acts like genuine compliments or thoughtful help from coworkers and physicians. These positive experiences significantly influence engagement. They are the moments of joy and affirmation.
So what's the implication of bad is stronger than good?
The profound implication here is that while positive events certainly offer new intervention opportunities and can boost morale, the dominant influence of negative events suggests that interventions should prioritize reducing job stressors and hazards first to maximize positive outcomes.
Tackle the bad stuff before focusing only on the good.
Exactly. It's like trying to fill a bucket with holes in it. You can keep pouring in the good, but if the bad is constantly draining it, you're fighting an uphill battle. To truly support healthcare workers, we must be relentless in identifying and mitigating the sources of the bad first, creating a more stable foundation for the good to flourish.
That makes a lot of sense. Finally, we delved into value congruence and professional commitment, which touches on the deep alignment between a nurse's personal beliefs and their work.
Yes, this is about feeling like your work aligns with who you are.
Nurses who genuinely felt that they could work ethically, even when facing high emotional labor, consistently reported higher levels of work engagement. There's a term for this.
Yes, work ethic feasibility. This profound concept powerfully aligns with the broader idea of person-organization fit, where matching personal values with organizational values and practices consistently leads to better outcomes for both the individual and the institution. Feeling like you can be true to your values at work.
And what about commitment to the profession itself?
Professional commitment itself is a rich, multifaceted concept. It encompasses a nurse's willingness to exert significant effort on behalf of the profession, their deep desire to maintain membership and continue practicing, and their unwavering belief in its core goals and values.
Does how they enter the profession matter?
Interestingly, yes. Studies indicate that nurses who willingly chose their profession from an early age, feeling a true calling, tend to demonstrate higher professional commitment, making them more resilient. Furthermore, having family members already in the healthcare profession can significantly impact a nurse's intention to quit.
Really? Why?
It suggests a powerful, supportive, familial understanding of the unique demands, stresses, and even moral injuries inherent in the job. That understanding can provide a crucial, empathetic buffer against burnout. They get it.
That makes sense. And then there's commitment to the specific organization, right? Effective organizational commitment, or ACO.
Exactly. This refers specifically to a nurse's emotional bond, their sense of attachment, and their personal identification with their organization, their hospital, their clinic, their unit.
What fosters that bond?
When nurses perceive tangible opportunities for career growth within their organization and consistently have a high-quality, supportive relationship with their supervisor, they naturally develop stronger ACO. They feel genuinely connected to where they work.
And what weakens it?
Conversely, feeling socially isolated from coworkers, feeling like you're on an island within your own team, can significantly impair this essential emotional bond to the organization.
And this bond matters for retention.
Absolutely. This emotional connection to the organization, in turn, acts as a crucial mediator, influencing both a nurse's overall well-being and their ultimate turnover intentions. If you feel that deep, positive emotional bond to your workplace, you're far more likely to stay, even when things get tough. It's a powerful internal compass guiding the decision to stay or leave.
Wow, what an incredibly deep dive this has been. We've journeyed through the complex, often challenging, and frequently unseen world of healthcare professionals, particularly our nurses.
It's certainly a lot to unpack.
We've uncovered the profound, multifaceted pressures they face, from the invisible weight of emotional labor and relentless workload to the unique tolls of a global pandemic, and even, the fundamental layout of their physical workspace.
But just as importantly, we've illuminated the powerful individual strengths these professionals draw upon every single day, like their self-efficacy, that unwavering belief in their own capabilities and their sense of coherence, that profound understanding of life's challenges that helps them make sense of chaos.
Their inner armor.
Exactly.
Yeah.
And crucially, we've clearly seen the vital organizational supports, like strong ethical leadership, cohesive teamwork, and those high-involvement work practices that are absolutely essential, not just for their well-being, but for their continued engagement and retention in these life-saving roles.
What stands out so clearly from all this research, I think, is that supporting these frontline heroes isn't just about individual resilience, like telling them to meditate more.
No, it's far beyond that.
It's a shared responsibility that demands systemic, thoughtful interventions. It's about building an environment where the good The compassion satisfaction, the meaningful work, the collegial support, the sense of empowerment can truly flourish.
Right.
And where the bad, the stressors, the conflicts, the burnout is actively mitigated, not just endured as an inevitable part of the job.
So this raises a profound question for all of us, doesn't it? From policymakers to hospital administrators and even to us as patients. If we now understand that the very structure and design of healthcare work profoundly impacts the well-being and capacity of those who care for us,
Yeah.
how might we as a society begin to rethink the foundational design of patient care delivery?
That's a huge question. Is it possible to embed well-being and stress prevention intrinsically into the system, right into the very core of how healthcare is organized and delivered?
Moving beyond just reactive coping mechanisms.
Towards a truly proactive, supportive, and sustainable model for those incredible individuals who dedicate their lives to caring for others.
That's the challenge, isn't it?
That's definitely something for you to mull on as you go about your day.